moved here to Pittsburgh, PA in 1999, mainly because I was infected with the HIV virus. And I come from a rural area where there was no help. There was no one to talk to, there was no meetings, there was no ICMs, no nothing. So I found out about the task force here in Pittsburgh, and I relocated. Just having the ICM and the task force meetings helped me to open up, you know, and kind of understand my disease and accept it. The first thing that you should do would be to go and get help, mental help, so that way that you can better understand yourself and what you're living with and how to control your life and things that go on in your life from there. That would be the first thing I would do. If they went to the task force, they would get all of the help that they need in one package. Classes, meetings, their pantry services, housing, which at that time was a big point for me. Just everything that I needed in my life at that time, it opened up a lot of doors for me because I had no one to turn to. The PATF kind of helps you get back your dignity of where you need to be going. I think it kind of helps you find your way back. I can't probably put it into words how much it means to me, the help and the support that we get, and how much more that there's other people out there like me that needs that help and support, and they're not getting it. So I would say that, you know, for everybody to keep trying to see us as still individuals who needs to still have a life, and to please, please keep contributing.
Well, my brother in 1993, he died of AIDS, and at the time we were in prison together. I got out, and my brother died, and the next thing I knew, they diagnosed me with the HIV, the same thing that killed my brother. The task force taught me about this disease, and you know, I came to believe, I came to know that it's other people's lack of knowledge, lack of understanding that is at fault here. It's not mine. It's here. I've got to deal with it. You're not in the world alone. Everybody's connected, you know, whether you're positive or negative or whatever you are. And whatever it is that you put in, that's what you get out. The task force, it freed me.
It was culture shock moving from Seattle back to Greensburg, which is basically pretty much what's considered a rural area. And I was apprehensive as far as who to talk to, where to find doctors at. Wasn't sure if I would find the right doctors. When I went to Falk Clinic, the caseworker there that I was working with is the one that recommended PATF for me. And I found everyone there was so easy to talk to and so genuine. I've been positive since 1992, and the stigma of being positive in the beginning was horrible. And with PATF, positive is just another, it's just another thing. It's just another word. With my Social Security, it's not enough to cover most of my expenses, so occasionally I'll need help paying a utility bill. They've had help with the mortgage. Different funding that they've had made life a lot less stressful. The food pantry once a month. With getting the limited amount of income that I have, using the food pantry to help stock at home, it really cuts down on the grocery bill. With what they've done for me, there's no way I could repay them for as much help as they've given me. So that's what I would let anyone know that came in, that was in the same situation. And it's great because my partner's HIV negative, and he goes every 3 months, and they do the same day testing right there with them, and very, very supportive. I'm healthy because I don't have the concerns of trying to figure out how am I going to make ends meet, where am I going to get help at, if something does go wrong, who am I going to talk to? And there's always someone there to talk to.
I had gotten sick one day and ended up in the hospital and found out my status, that I was HIV positive. And fortunately, my doctor had done work with the Pittsburgh AIDS Task Force. They really got me connected with the task force and informed me of the services and things that were available to help me. I had ended up losing my job because of my illness and missing work and things like that. And financially, I was devastated. I was homeless. I had become homeless. And so it was very hard to focus on the disease and maintaining my health, dealing with all those other outside issues. So it was really instrumental that the task force was there, and you know, I consider them, they saved my life. I'm in the housing program, which is probably the best program in the whole country because the support is there, the encouragement is there, and they really seem to care about the clients. And it's not a client employee relationship. It's kind of like, you know, we're here for you, we're your friend, and we're going to do what we can to help you or to help you help yourself. I recently went back to school to earn a college degree, and it was the Pittsburgh AIDS Task Force that paid for my first college class. And I thank them very much because I just earned my associate's degree this summer. And you know, it was a great achievement for me, and without the Pittsburgh AIDS Task Force giving me that start and the encouragement and support, I don't think it would have been possible for me to earn my degree. You know, it's funny because I got the letter in the mail myself, and I had a couple bucks in my pocket, and I put $1 in there, and I didn't put my name on it, but I sent it in because I knew how important every dollar is to people like me and people who will need it, you know, in the future. And this organization does such good work for people and helping people in their lives and saving lives and keeping people from losing their, you know, their sanity. And every dollar helps. And you know, if I could give, you know, everything I had, you know, I would. If I hit the lottery, I said if I ever hit the lottery, I give half to the task force, you know, because they do such good work.